Welcome to a Pocket Prescription episode, a short, no-nonsense take on a health or fitness topic that you've asked for. You can also watch the video version on my YouTube channel. If you have high blood pressure, you've probably been told not to lift anything heavy. Don't hold your breath, don't strain, don't lift weights, it's dangerous, blood vessels will burst, bad things are going to happen. This is fear and it's not based in evidence. Let's get into this properly. I'm Dr. Lynette Ewart. I'm a GP in the NHS and I'm also a personal trainer. After my last video on why resistance training should be considered as a powerful tool for long-term blood pressure management, the question that kept coming up is, yeah, but is it safe? That's what I want to deal with in this video today. So give me less than 10 minutes, less than the time you'd have with your GP, and I will tell you what people think the risk is, what actually happens to your blood pressure when you strain under a load, why there's so much anxiety around breathing, holding your breath and Valsalva, which cohort of people maybe need to exercise a little bit of caution, and why that isn't the majority of people who are diagnosed as having high blood pressure. This conversation needs nuance, not drama. What people tend to imagine is going to happen when you lift a heavy load is that you lift something, you brace, you strain, your blood pressure goes up, pressure on the blood vessels, bursting blood vessels, boom, stroke in the squat rack, you're out of it. That is fear and it's a powerful image, but let me show you why this just isn't based in physiology at all. And I'm afraid to say even some healthcare professionals do get caught up in this fear-based narrative as well. And remember, if this were a real risk factor, we would see huge clusters of strokes in the gym. And at the time of recording, that data is nowhere to be found. So yes, blood pressure does rise when you strain. That part really is not controversial. But it also rises if I go out and have a row with a neighbour for parking across my drive. It also rises if I carry the shopping from down the hill, up the hill and into the house. It rises if you run for a flight or anything else. You want your blood pressure to rise. That is normal. It's not meant to stay at one static number throughout the day. And in fact, you'd have an awful lot of problems if it did stay at that one number, such as falling over when suddenly your blood pressure needs to rise. It fluctuates, that's normal physiology, that is not a problem. But the question still sits with people as to whether or not that rise is harmful in them because they're already on treatment for high blood pressure. But remember, we're putting you on treatment to bring your average down. It's still going to fluctuate throughout the day. It's the average elevation of blood pressure over time that raises the risk, and that's what we're looking to reduce. Now let's get into the drama that exists around breathing and what's known as Valsalva manoeuvre. In strength training, we make use of bracing. And this is also known as the Valsalva manoeuvre. You'll be familiar with bracing. Imagine somebody's about to tickle you, or you're bracing yourself for something really difficult and you tense everything up. We do this because it provides stability around the middle and around your spine, and that's really valuable. But the exaggerated fear comes from this idea that that increased intra-abdominal and intrathoracic pressure somehow also transfers into your brain and your blood vessels and can cause a rupture. But there's a really key physiological point that you need to understand about rupture. Rupture happens when you get uneven pressure across a blood vessel wall. Big high pressure on the inside and nothing to match it on the outside. But when your internal pressure rises through Valsalva or through bracing, the pressure rises on both sides of the wall. So it's not uneven, which is why we're not seeing record numbers of vessel ruptures in weight training or in sports for that matter. It's really not the same situation as somebody with an aneurysm where the pressure is all on one side. Remember, your body's designed to tolerate fluctuations, otherwise we'd have a hell of a problem every time we had a coughing fit. So who really does need to exercise caution? Okay, let's say your blood pressure is currently very high and uncontrolled. Well, make that the priority and sort that out first. Maybe you know you have an unstable aneurysm in your aorta or in your brain. Please talk to your specialist in that situation. If you've had any kind of surgery, structural repair, and things are healing, then caution needs to be applied in those situations, obviously. But these are all specialist conversations, not the majority of people managing their high blood pressure on medications like the patients I see and the clients I coach. The evidence does not show that people with managed high blood pressure are at greater risk from resistance training. It's the opposite. People who are not managing their risk factors are at a greater risk. So how hard is too hard, you might be thinking? And that's a reasonable question. And it's somewhere that people do get stuck. Should you stay light forever? Should you stop when your face goes red? Should you avoid anything at all that feels challenging? No. Categorically, no. Safe does not mean timid. Safe means structured. If your blood pressure is stable and being treated, you can train. You can lift with intent. You can progressively make things harder. You can brace safely without worrying that your head is going to explode. You can still enter competitive events, train for them like anybody else in a progressive, structured approach. Your cardiovascular system will adapt and progress in the way that it's meant to, and you won't be putting yourself at risk. Too many people are focusing on this theoretical spike and considering it to be a risk without considering the trade-off of risk that comes with not training your body to adapt to normal physiological loads and stay strong. And we're particularly good in medicine at taking a rare high-risk scenario and elevating the fear around it, not realizing how many people will be paralyzed into inaction on the back of that. Stable, treated hypertension is not the same thing as being medically unstable. You are not fragile, thankfully. So remember, high blood pressure is one of the few risk factors you can actively train to lower your cardiovascular risk, and being nervous of it is not going to help you in the long term. Fear feels protective initially, but remember, long term, that cascades into deconditioning, and there's nothing protective about that.